Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm delighted to be able to join you this afternoon to talk about where we are with respect to COVID-19 for the entire state of Maine for today, Thursday, April 8th, 2021. I begin today's update on a sad note. The Maine CDC has received the reports of an additional individual who has died with COVID-19. She was a woman in her 70s from Saginaw County, and her passing marks the 748th death associated with COVID-19 since the beginning of the pandemic. I'd like to take a moment to offer her friends, family members, and her entire community our deepest condolences. Overall in the state, there are a total of 52,996 cases of COVID-19, an increase of 319 cases since yesterday. Cumulatively, 1,714 people have been hospitalized, and right now in Maine, 78 people are in the hospital with COVID-19. 30 of them are in the intensive care unit, and 10 of them are on a ventilator. Our positivity rate in Maine for PCR tests conducted over the last 7 days now stands at 2.8%, and our testing volume is now at 603 PCR tests for every 100,000 people. The positivity rate for antigen tests over the last 7 days is 6.4%, and the volume of antigen tests conducted over the last 7 days is averaging 165 tests for every 100,000 people per day. Let's turn to vaccinations and vaccines. First, in terms of the total number of vaccines administered across the state. As of this morning, there have been 823,594 total doses of COVID-19 vaccine administered statewide. 483,293 of those are first doses. 340,301 of those are final doses. Let's put those numbers in a bit of perspective. If you take a look at who is eligible to receive a COVID-19 vaccine in Maine, that is to say, anyone 16 years of age or older. Of that age cohort, 43% of those folks have gotten at least their first dose. And over 30%, almost 1 in 3 of Maine people 16 and over has completed their COVID-19 vaccination series. This is solid progress. Right now, Maine is administering approximately 15,828 doses of COVID-19 vaccine every single day. And as supply of the vaccine has increased, so has our administration rate. 2 weeks ago, on March 25th, we were administering 11,184 doses a day. Today, that number again stands at 15,828 on average. That's a 40% increase in our daily administration rate just over a 2-week period. Now, some of that is because we're getting more vaccine, but some of it is that we were ready to turn those vaccines into vaccinations. These numbers of vaccine doses administered every day, they're not an accident. They're not good luck. They are the result of planning, precision, and collaboration. And much of the credit for these numbers goes to the scores of healthcare providers of all stripes who are out there across the state every single day putting shots into arms. At hospitals, at pharmacies, and at fire stations across the state. Those folks every single day are the reason why Maine has made the progress that we have. I'd like to take a moment to offer them my deepest thanks for standing by us and working with us to roll out the vaccination. This work comes on top of a very difficult and grueling year for healthcare providers across the state, as we've seen. But when the mission changed and called for us to pivot and start administering vaccines, without fail, healthcare providers across the state, whether they were nurses, physicians, or EMS clinicians, when we asked for help, they said, absolutely, what can we do and how can we do it? And they are the reason where we are today. Turning now to vaccines. The state of Maine is also putting in our order for vaccines for next week that'll be coming into the state. From the federal government, Maine has been allocated 19,980 first doses of Pfizer vaccine, 14,300 first doses of Moderna vaccine, and 2,500 doses of the J&J vaccine, for a total of 36,690 first doses of coming to the state's allocation next week. Now, unfortunately, that number represents a decrease of about 18,100 doses of vaccine that we are getting next week as compared to this week. And that decrease of 18,100 doses is comprised of the decrease in the J&J supply. Now, as we've talked about, the J&J supply is going to fluctuate. It has been fluctuating and it will continue to fluctuate, unlike the supply of Moderna and Pfizer, which have been relatively stable. The J&J vaccine supply for the next week, that'll be coming into Maine, as well as the subsequent week, the weeks of April 12th and the week of April 19th, are thought to be lower than they were current week. That's unfortunate. It means that, for example, next week, some groups that would like to be out there, out in the field doing vaccinations, like EMS clinicians, may not be receiving vaccine. It also means that for the subsequent week, allocations will be a challenge. We are hopeful that later in April, those numbers, as they have been fluctuating, will pick back up. Now, we don't know what will yet be delivered to pharmacies and community health centers across Maine. But based on the early views that we've received from our federal partners, the numbers of vaccines that they will receive too will likely be down commensurately with the state supply. What does all this mean? Well, it means that the demand for vaccine still outstrips the supply that we are getting. To put it differently, more folks want vaccine than we've got for them right now. It also means that there are things that you can do to help. For example, if you have made more than one appointment for a COVID-19 vaccine, please let the clinic know that you're not going to be there for all of those. That way, we can make sure that every dose that we get next week goes into an arm next week. One additional vaccine update. As we talked about on Tuesday, the state of Maine will soon be receiving a partnership or initiating a partnership with our colleagues at FEMA to be deploying a mobile vaccination unit to various underserved, at-risk parts of the state. That mobile vaccination unit is slated to start vaccinating in Oxford County at the Oxford Casino next week, starting on Monday. Unfortunately, the schedule for Monday and Tuesday for vaccine slots is booked. But there are afternoon appointments available on Wednesday and additional appointments scattered throughout the day on Thursday and Friday. If making your way to the Oxford Casino to be vaccinated is available to you, the best way to get an appointment is to call the Maine COVID-19 Community Vaccination Line. That number is 888-445-4111. That community vaccination line can not only help you get an appointment for the Oxford Casino, it can also help you get an appointment at any number of the other places in Maine that are also offering COVID-19 vaccine. That number again is 888-445-4111. Now, this phone number is not a priority access lane, but they can help you navigate some of the websites to get an appointment. And right now, they are the principal means by which to get an appointment at the Oxford Casino. Again, there are appointments available next week. Don't hesitate to call that number if you'd like to try to get one. And finally, before I turn to our colleagues in the media, I wanted to take a moment to answer a few additional questions that you have sent into us just in the last week around your questions, your concerns about the COVID-19 vaccine. So I'd like to take a moment today to answer 3 of the questions that we've seen come up or come to us repeatedly just in the past week. The first of those questions is, how long will the protection from the vaccine last? And the answer there is at least for 6 months. This doesn't mean only 6 months, it means at least 6 months. Indeed, most scientists believe that the protection will last substantially longer. Now, we're all anxious to know how long the protection from vaccines will ultimately last. But with a brand new virus and even newer vaccines, we have to be patient as we gather more data around exactly how long that protection may last. But the good news is that we are learning more every single day. Indeed, recent data around the Pfizer vaccine give us confidence that the protection afforded by these vaccines is not falling to the wayside quickly. A recent study tested the blood over time of people who were naturally infected with the COVID-19 virus. What they found was that most people had shown immunity naturally at least 8 months after the infection. And 8 months is exactly how long they were observing people. What we know about the vaccines is that they produce an even stronger immune system response than does being naturally infected. But the studies that we have to date around how long the protection from the vaccine lasts have only been going on for about 6 months. All signs point to immunity that lasts even longer. But as we talk about things like new variants on the horizon, there is the possibility out there that we may need to have a booster shot, even though the vaccines are performing very well against the variants so far. We'll know more about how long that protection lasts as we get more data, but that shouldn't be a reason to avoid getting a shot today. What we know right now is that the vaccines can protect you today. As we learn more, we'll have a better sense of exactly how long that is. Another question that's come up in recent days is whether the negative side effects of vaccines might be fatal. Now, this is something that's been circulated in various quarters for a while now. But here is the bottom line, and I want to be crystal clear. There is absolutely no evidence whatsoever that the COVID-19 vaccine can cause death. Indeed, it's the exact opposite. They are proven to prevent death, not just of you, but of those around you. Now, there's one twist on this claim, the claim that seems to be omnipresent, that the mortality rate from COVID-19 is only 1%, and therefore COVID's not that dangerous. But let me tell you something, a 1% mortality rate is still 10 times more lethal than the seasonal flu, according to the Mayo Clinic. In addition, the mortality rate associated with COVID varies widely, and it's influenced by your age, your gender, and underlying health conditions. For some folks, that mortality rate can be significantly higher. When we have a vaccine that we know is not just safe, but remarkably effective, well, now is the time to go get it. The bottom line there is that the vaccine prevents death. It's not associated with it. And finally, a question that's been coming up now with increasing frequency, which is, do I need a vaccine if I've already had COVID-19 and have recovered? And the answer is yes. You should still get a vaccine, whether or not you've previously had COVID-19. Now, although coming down with COVID and recovering appears to give you some immunity to the virus, again, we don't know how long that immunity will last, how powerful it is, and how much it will protect you against things like variants. But we do know that the immunity that you get from a vaccine seems to be stronger than the immunity that your own body produces after it's been exposed to COVID. And as I mentioned a moment ago, that immunity from the vaccine lasts at least for 6 months. That's why we recommend that even if you previously had COVID-19, you still sign up to get a shot. There are two exceptions. One is if you are currently positive for COVID-19. And there, you should wait until you are safely out of isolation, partly so you don't risk infecting anybody. There's another category of folks who should wait a bit longer. That's a small category, but these are individuals who were treated for COVID-19 with a type of drug called a monoclonal antibody, or another type of treatment called convalescent plasma. Those folks should wait at least 90 days after they've finished up their treatment before they get their shot. With that, I would like to turn things over to our colleagues in the media. The first question for the afternoon goes to Joe Lawler.
Yes, hi. Thanks for taking our questions today. My first question is, I know you were saying that the J&J doses will be lower next week, and it doesn't look like that there will be even an increase, or it sounds like it's going to be even a decrease in the retail pharmacy program. So I guess I'm wondering, do you know why that is? What's causing the downturn in supply?
Joe, it's a great question. I myself have posed that exact question to our federal colleagues, and I perhaps put it a bit more sharply than you did, which is was the news that we learned about around about a week ago involving the production plant in Baltimore related to this. What I've been told, Joe, is that some of this was cyclical. That is to say, the J&J vaccine, the production was always expected to fluctuate. I have not yet received the complete answer, the final answer as to whether the incident in Baltimore that was discovered and detailed also is related to this. I am hoping to learn more on my next call with federal partners. But Joe, I have the exact same question you do.
Okay. And so I noticed that there were for this week, there were some independent doctors who received doses of J&J, but it doesn't look like they'll get it for next week. I assume that's just a supply issue. Do you still plan on, when the supplies go up, to have the independent docs be a part of the J&J distribution of the vaccine?
Yes to both. You are correct that this week there were 400, the current week that we are in right now, 400 doses of J&J vaccine were allocated to independent medical providers with whom there was already a provider agreement in place and who had indicated an ability to utilize those doses with their patients this week. Those doses are at their clinics and being used right now this week. But given that significant reduction, 18,100 fewer doses coming into the state next week as compared to this week, there were a fair number of groups that got vaccine this week for whom we don't have the supply next week. That included, unfortunately, independent medical providers, some independent pharmacies, EMS clinicians. It's not desirable. It is not ideal whatsoever. We recognize that a lot of those groups were anticipating, banking on the fact that they were going to get doses so they could vaccinate their patients, their constituents. Would that were the case, I wish we had more supply coming in, but what you see on our allocation spreadsheet is purely a function of us not having the supply.
If I could squeeze in just a super quick question. I saw that there's been more studies that show that there seems to be very little transmission of the virus in outdoor settings. And I'm wondering, if say a month or a couple months from now, if our cases start to go way down, would we rethink the mask mandate in terms of outdoor spaces?
A good question, Joe. As you know, I can't speculate on what those data may be and how policy may evolve around that in coming months. But what I can agree with for sure is that one of the pleasant findings thus far in an otherwise very difficult year has been the initial finding that outdoor transmission of COVID-19 is anywhere from 90%, even more than 90% less likely to happen in outdoor settings compared to indoor settings. And that finding has held true and constant throughout the pandemic. As you noted, there have been even more recent papers that have substantiated that initial finding, which I think came from Japan round about a year ago now. What that means for policy, it's too early to tell. We want to know exactly, it's not just about what the masks show, what outdoor transmission shows, but it's also about what variants may show, what the overall case numbers are, what the positivity rates are, what kind of efficacy we're seeing from vaccines. It's so many other factors than just those two. As you know, Joe, I can't speculate on where we might be, but I will say that I am encouraged by the continual finding that outdoor settings are significantly safer than indoor ones. Let me turn next to Caitlin Andrew.
Good afternoon, Dr. Shah. When the vaccine effort first started, it seemed like Northern Mainers are having a harder time finding appointments than Southern residents. And recently, it seems like that trend has switched or kind of evened out, with Southerners seeming to have a hard time finding appointments locally. To you, does this indicate an imbalance in where we are sending vaccine, or is the demand in the southern part of the state just higher?
I think there is certainly a demand component to it. There's no question about that. But Caitlin, just to level set on the numbers, right now we're seeing an interesting variance across the state in terms of the percentage of populations in different counties that have completed their vaccination series. Leading the pack right now is Washington County, followed very closely behind by Aroostook and then Lincoln County. But we've got more work to do in Androscoggin County, Oxford County, so on and so forth. The southern part of the state is sort of right in the middle of the pack. York County is at 23%, Cumberland County a bit higher at 27%. So there's a lot of variance. I don't know that I could draw a straight trend line county by county across the state. There's just a lot of variance. All of that is to say, we know that access remains a problem. There's no question about that. There's a lot more demand for vaccine than there is vaccine. On one level, we want to encourage that. We want folks to make sure that they are angling to get their vaccine. I'm hoping that as we get more vaccine, we can satisfy that demand. But I think some of what we're seeing right now is that there are fluctuations. We've made sure that we've allocated a lot of vaccine to rural parts of the state, like Washington County, like Aroostook County. And so we've made sure that they were ready to go, and they are. Now we've got to make sure that we can get vaccine to other parts of the state that are trailing. You'll notice on this week's allocation chart, Androscoggin County is getting an extra tray of Pfizer as compared to prior weeks, hoping to make up some of that delta. I don't know, again, that I would draw any generalities. We're always trying to find out where we need to focus our efforts more and get more vaccine to that way.
What makes it difficult to kind of draw any conclusions from that data?
Well, I think it's because they just point in such different directions. Again, on one hand, there are rural counties that are leading the pack right now, like Washington and Aroostook County. Urban counties are somewhat in the mix. I think it's just because there's a diversity of counties. There's not a clear trend where necessarily southern Maine is experiencing challenges and northern Maine is doing okay, or western. It's just, there's not really a clear trend one way or the other.
On Tuesday, you said that you take sustained demand into account when considering how to allocate doses. Can you talk a little bit about how you've changed allocations recently based on demand?
Yes. Well, one of the things that we look at when we are making allocations is how many slots are being filled when they open up, which is a pretty good proxy for how much demand there is out there. And one of the things that we've seen most recently is that demand, say, in Androscoggin County remains very, very high. That's one reason why we have allocated additional doses there for the next week as compared to this week.
Okay, and can you kind of walk me through, I think I've probably asked you about this at least 3 times now, can you kind of talk me through your process during the week of like when you first get a sense of what demand is looking like, and then how and at what point in the week do you use that to make your decisions on where vaccines will go?
Sure. So there's two elements, Caitlin. There's supply and then there's the demand side. Let's talk first about the demand, since that's where you started. There are a number of factors that influence what the demand for vaccine is. The first is, first of all, how many appointments are just available? That's number one. We don't want to give any particular institution more doses than they have slots available for. Number two, how many of those appointments are booked out? Number three, how many doses do they already have on hand that they didn't use in the preceding week? And then number four, how many of those doses are they actually able to use in the subsequent week? That is to say, if an appointment's booked, if it's confirmed, and they have a clinic scheduled and ready to do it. Those are the elements of demand. The other then is the elements of supply. Some of that is how much are we getting as a state? Some of it is, again, how many doses and vaccinators they have on hand. And then the third is whether we can move doses around throughout the week. So the allocations that we announce on Thursdays are literally just the first step. Every other day throughout the week, we are moving doses around. If a particular clinic is oversubscribed by 100 people, if we can find an extra 100 doses, we move it there. That happened last week. I got a call late last week from Chief Schools down in Buxton who said, hey, I got a drive-through clinic planned on Saturday, and we are seeing demand through the roof. Can you get another couple hundred doses for their J&J drive-through clinic? And I said, let me see what we can do. Given the strong demand, he put up the appointments and they were snapped up in, I think, a couple of minutes, maybe 30 minutes. With that kind of demand, we worked to see if we could move doses around, and we did. We were able to get Chief Schools an extra 200 doses, and he administered them all on a day.
Okay, my last kind of follow-up on this is that it certainly seems like the Russian interest is highest once eligibility first opens up for a new group. Do we think that we will see a difference in trends like as the effort goes on and like the general population becomes more vaccinated, or do you think this will be a sustained trend?
Hard to say. I think we'll see sustained demand for a while. Again, as we opened up yesterday to any Maine person 16 and over, that's a group comprising roughly 430,000 people who are newly eligible. In previous groups, when we opened up, those were groups of on the order of 170 to 200,000 people. So I think that sustained demand is going to stay with us. Our job here, what I see my principal job as, is to try to keep that demand high. To the extent demand is flagging or waning, if it's because folks have questions about the safety, efficacy of the vaccine, they're hesitant, my goal is to try to provide them straight answers to get their questions up, to answer their questions, so they go with that next step and make an appointment.
Thank you.
Let me turn it over to Chris Costa next.
Hi, Dr. Shah. Just wanted to start with what you addressed at the top about the drop in Johnson & Johnson this week. How will you address sort of the areas that we've talked about in the past are well suited for J&J and that the state had maybe intended to send Johnson & Johnson doses to? How will the state kind of call an audible here?
Yep, you mean given the decrement in doses? Well, correct. Chris, one thing to note is that a related question is, where is our allocation of Johnson & Johnson going this week? And much of it is going for the mobile unit. That mobile unit is designed to fill in gaps in vaccination in areas of the state where we know that there is demand and not supply. So one way that we make up that delta, Chris, to make up that ground is via the mobile unit. It's starting off in Oxford next week, and then in Windham, and then down to Biddeford. So those are areas of the state where we know there is demand and there may not be a large-scale vaccination site. So the mobile unit is a really critical piece to our strategy there. But the other way, Chris, is that the week that we are currently in, given the possibility that there might be a decline in J&J, we made sure we made allocations to places that we know could use those doses this week in many of those places, like independent pharmacies, independent medical practices, EMS clinicians. Now, many of those groups use all of their J&J, which is what we asked them to. But to the extent that there are any available, we can move those around and try to get them into the arms of other hard-to-reach populations. Make no mistake, Chris, it's going to be a challenge, right? This is a significant decrease in the amount of J&J we're getting. It's going to be a challenge, but the mobile unit being able to provide vaccine in vulnerable, rural, hard to reach areas, that's one way we can make up that. The other is that we can try to keep moving doses around if they haven't all been used.
Okay, I'll keep on that kind of same vein along with the mobile unit. We've looked at some of the locations on the mobile unit. You had kind of referenced some of them just now with Biddeford and Wyndham being places that you guys know maybe don't have a large scale site near them. There are other portions of the state that I think other people would also consider to be rural or hard to reach, where the mobile unit is not making a stop. One of those, I believe, is Somerset County. And I'm sorry to keep bringing that up over and over again, but I believe Waterville might be the closest location to there. Is there a reason why the state or the feds is not sending the unit there or certain other places that might be considered more rural?
Yep, it's a great question, Chris. I'm certainly well aware of that. The Somerset County continues to be an area of concern. Vaccine access, vaccine availability is not where I would want it to be in Somerset County. I've had the chance to visit Reddington, Fairview, and Skowhegan and talk with the leadership there about what they're seeing across the county. And indeed, the numbers bear that out. Only about 21 or 22% of folks in Somerset County have completed their vaccine series. We're looking for a site that we can utilize and place the van there, the unit there. Although we've charted out where we think the unit is going to go, there are still some possibilities. We haven't really identified an ideal site, and that's the main reason. We also have spoken with healthcare providers there on the ground who, according to them, between Reddington, Fairview, as well as EMS agencies, are able to provide coverage, but we're still trying to see if there's more that we can do. Your question's the right one, Chris. Still trying to sort that out, but that's where we are right now with respect to Somerset.
Okay. And then lastly, just talking about, you've kind of addressed this in a couple of different ways. So if this is redundant, please feel free to kind of gloss over it. But obviously we have higher demand now with the increased number of people newly eligible. Also next week, we're going to be seeing a significantly lower supply as when it comes to J&J in particular. How is the state planning to kind of handle this? I don't know if dichotomy is the right word, but the increase of demand and the lower supply. How will the state navigate that?
Yeah, no, it's a good question, Chris, and we haven't discussed it head on. So I'm glad you raised it. I mean, initially, right, it seems to be going in different directions, but I don't think that's necessarily the case. The first is that these fluctuations in supply are somewhat temporary. We hope, we anticipate, we've been told that the J&J supply will in fact increase toward the end of the month. The other thing, Chris, that I think is critical is that as we saw right before we increased the eligibility toward last week, there were appointments that were going unfilled. And that was before we got the significant influx of J&J this week. Now, so I think we can do both. Now, there may be folks that have to wait. Unfortunately, the demand is still a lot greater than what we see in terms of our supply. But the alternative was to keep eligibility where it was and then run the risk that there would be unfilled appointments. That wasn't a risk I was willing to run. We're in the middle of the pandemic. Variants are all around us. I wasn't willing to let a single appointment go unfilled, if at all possible. That's why I felt comfortable expanding the eligibility as we did. Making it eligible to those 16 and over means that there may be folks, again, who have a challenge finding an appointment. I recognize that. It's not ideal, but it also means that as we get more vaccine, they're primed and ready to go to get a shot.
Okay, and then last quick question. It seems that Wednesdays tend to be a particularly strong day in terms of vaccinations. I'm wondering if there's a reason for that, because I think if I noticed correctly today, this is the first time that the state has administered more than 10,000 first and final doses in a single day, correct?
You are correct. As to both of those, Wednesdays, Thursdays do tend to be bigger days. So the question, I think, Chris, behind your question is what governs the days of the week in which vaccination sites do the bulk of their vaccines? I myself have, again, had the privilege to travel around and talk to those who are operating sites, particularly around this question of what days of the week matter. I had the chance not long ago, well, a little while ago, to talk with the head of pharmacy at Northern Light, because I asked the same question. What's magical about Wednesdays and Thursdays and so on and so forth? A lot of it has to do with the number of days between when a vial can be opened. Again, sites are shifting vials around, and there's X number of days or X number of hours between when vials can be opened when they have to be used. So clinics are staggered through the week to eliminate the possibility that a single dose goes unwasted. So clinics are always within 5 days of each other. And that is particularly those that use Pfizer and Moderna. And that is in large measure why you sort of see this day of week effect. It has a lot to do with how long vials can be used for.
Gotcha. Thank you so much. Thanks for the patience.
Yep. Yeah, absolutely, Chris. Over to Amy Brown next.
Thanks, Dr. Shah. Just following up on something you said earlier about the possible need for a booster to deal with variants at some point. Do you think the variants that are now known that have emerged already will require a booster at some point? Or are you talking about speculating about maybe there'll be some other variant that does require one?
It's a little bit of both, Amy. But I will just channel what I've heard from experts like Dr. Fauci and Dr. Walensky, the CDC director. And what they have both indicated is that right now, it's unknown scientifically whether a booster will be needed for either the existing variants or for future variants. Dr. Fauci has actually gone a step further. I heard him say in the national media around about a week ago that he actually didn't think a booster would be necessary. But I've heard other, maybe not as renowned, but pretty darn renowned infectious disease specialists speculate that maybe they think there will be one. The scientists are still studying that issue, but that analysis applies both to the existing variants as well as to any that are not yet known.
Okay, great. And we've heard from a couple of listeners who received their first dose of vaccine through one of the retail pharmacy waste list programs. And they were told at the time that the pharmacy would get in touch. They weren't given an appointment for a second dose. They're at the 3-week point now. They've been the pharmacy never got in touch with them. They've been told basically they're on their own. They need to get in line with everybody else and try to make an appointment online within the retail pharmacy system. And now they obviously have a lot of competition for that. So they're wondering what responsibility the pharmacies have to make sure that they get second doses to the people they gave first doses to, for one thing. And then also, what happens if they go way beyond that recommended time frame for getting their second vaccine? Do they have to start over and get 2 more doses, or how does that work?
Sure. So according to the US CDC, folks can get their second dose under certain circumstances, under extraordinary circumstances. The second dose can occur within 42 days after the first dose. And even if that 42-day window is not met, that 6-week window is not met, the CDC does not recommend restarting the series. They recommend getting that second dose. And even if it's ideally within the 42 days, you don't need to restart the series. After that 42-day window, the CDC hasn't put out clear guidance on that yet because there aren't enough data. But based on what I've been told, even if you get your second dose beyond that 42-day window, there isn't a need to restart it. You just need to get your second dose. Okay. Now, that is not the recommendation. That is in that extraordinary circumstance where you can't get your second dose at the 21 or the 28-day mark. Most folks in Maine, based on the data that we get, which we receive all those data, the overwhelming majority of people in Maine get their second dose as per the recommended schedule. It is a rarity for people to go systematically without getting their second dose. Indeed, some of that is because of a policy change that we made. A few weeks ago, we indicated to vaccination sites in Maine that they should be offering second doses to people, even if that site did not give that person their first dose.
Okay, that was going to be my second question. So although the registration systems look for people like they're signing up for a first dose, they were wondering if they could go through trying to register someplace else where they can find a dose and just let them know when they get there that it's actually their second.
That is correct as to both, Amy. They can do that and they should do that.
Okay, great.
Mhm.
Thank you.
Thanks. Let me turn it over to Patrick Whittle next.
Thank you very much. So I have a couple of questions here, one of which pertains to the rollout. Is it possible yet to speculate on when we might approach something resembling a herd immunity threshold, and what would it be?
Is it possible to speculate? I mean, I suppose, but Patrick, I don't, you know me, I don't typically like to do that. So here's where we are overall. We're at this point right now where statewide, if you take the entire state, not just those who are eligible, but everyone in the state, our relevant population, roughly 1 in 4 has completed their COVID-19 series. That's if you use the entire state. And then when you factor in the number of folks who have been infected with COVID-19, 52,000, almost 53,000 today, right? You start to get to a point where you get to certain thresholds of populations that have some degree of immunity, naturally or through the vaccine. The difficulty is as follows. We don't really know yet exactly what the herd immunity threshold is. And so it's hard to know what that target is. Some epidemiologists have said 70%, others have said 85%. No matter what it is, we're not 100% there yet. I don't know when or how, what it will look like when we get there. That's because there is this notion, Patrick, that when you get to whatever that threshold is, the disease in question just kind of falls by the wayside. But it doesn't quite work that way. There are still people out there who will be transmitting COVID even after we reach that threshold. It just won't be as fast. It won't be as furious. It'll be a reduced amount of transmission, but it'll still be with us. Hard to say when that will be, though.
Okay.
How was that non-speculation speculation?
That was good. Thank you very much. So somewhat similar, but also kind of different question here. Now that we're sort of reaching private providers who are doing this, there's some question in the community about copays and whether there can be copays. And I know you're not, the Department of Insurance, but I imagine you've probably heard this. And what is the status of copays? Because for some people, $30 is a barrier to care that they can't necessarily suffer.
Patrick, I am not the most knowledgeable person on this exact issue. My understanding is that even copays are not part of the process here, but we will get you the exact answer from the right people who know more than I do. I know that this is an issue. I've definitely heard about it. I've received emails and tweets and outreach from folks who've said, "Hey, this is hard for me. This is a challenge, and it's going to affect when I can get my vaccine because I've got to make sure I can cover that copay." So you're absolutely right. That is a barrier. What the exact parameters around that are, I want to make sure I'm crystal clear and accurate on. So we'll get you the exact answer there.
Okay, terrific. One final thing, some restrictions lift on gatherings on May 24th, I believe is the day. Just wanted to double check that we're still in a position here where that's kind of a dynamic date that could change based on what the status of the pandemic looks like in Maine on May 24th.
Well, yes and no, Patrick. Yes, in the sense that given, it's a pandemic and of course there are always unknowns. So in that respect, it could change, but we have no intention of changing it right now. It's not a provisional date. It's not a theoretical date. It is a date. It's the date right now, and it's the baseline. We don't have any intention or even any notion that it would change, but it's not a fait accompli that it won't. It's theoretically possible that the pandemic could take a really significant turn south and things could get far, far worse. I can't rule that possibility out. If that were the case, then we would reevaluate, but that's not what our discussion is at right now.
So right now we're looking at May 24th as being a relatively firm date for raising attendance caps.
Yeah, I think that's accurate. It could change, but there is no plan or even discussion right now about changing it. But recognizing as well that that's 5-6 weeks away, so much can change. In pandemic time, that's decades.
Got it. Thank you very much.
Yep, thanks, Patrick. Over to Bonnie at the Sun Journal next. Oh, hey, Bonnie, sorry, you're on mute.
I apologize, doctor. You mentioned earlier Androscoggin is getting an extra tray of Pfizer. I haven't looked at the numbers. How much is in a tray of Pfizer?
A tray of Pfizer refers, you're right. I use that term as if it was just well known. So a tray of Pfizer comprises 1,170 first doses.
Okay.
Generally, and this is for the Auburn Mall Central Maine Medical Center site. Generally, they have been receiving 2 trays of Pfizer. But in my conversations with them over the past few days, they have expanded their capacity to administer more. And as I've noted, Bonnie, we've got more work to do in Androscoggin County. So as a result of that, they will be getting at least an additional 1,170 first doses. And then my team and I are again scouring the land to see if we can find additional doses for not just the Auburn Mall location, but other providers in Androscoggin County as well.
Well, hey, on behalf of Androscoggin, thank you. We'll take it. The second question is, this kind of puzzles me. Just today, the Lewiston school superintendent announced an uptick in cases every day. The schools have had positive, to the point where he's nervous about being able to keep schools open. And meanwhile, what do your investigators find when they look into outbreaks? What are the reasons? I mean, with so many people apparently masking and getting more shots, I'm confused why we're continuing to get such an uptick. Yeah,
I was huddling with some of our epidemiology team just earlier today to see what we're seeing and learn about what we're seeing. Seeing a couple of things, and I'll start with schools, Bonnie, because that's where you started. What we're not seeing is sustained or pronounced transmission within schools. We're certainly seeing cases within schools, but we're not seeing significant evidence of widespread transmission in schools. There is some. I'm not saying it's zero, but it's not significant. And indeed, the risk of having COVID in a school is lower than the risk of getting COVID in the general community. So what we're seeing is kids getting COVID outside of the school setting, but being detected because of their association with the school. More generally across the state, you're right, you raised the right question, Bonnie. What's going on? Why are we seeing cases still? Based on the discussions I've had with my team and then with others around the country, much of the increase seems to be associated with the spread of new variants. Not all, but much of it. The variants are thought to be more contagious. They are also thought to land people in the hospital at higher rates. It's one reason why we're seeing more disease and relatively steady hospitalizations. So I think that's in general what we're seeing, which is to say masking is great, but even with really, really robust masking, there's still the possibility that in other settings, small community gatherings, things like that, there still might be transmission. The last thing I'll mention really, really quickly is what we have seen around who's getting COVID in Maine. What we've seen over just the past few months is that the average age of people diagnosed with COVID has come down quite significantly. In December and January, the average age of a COVID case was 42 or 43. 44 in December, 43 in January. In March, that fell to 37. That's the average. It's a pretty significant decline. Just tells you what's going on with vaccinations. We're seeing younger people get infected, not older people.
Okay, so with the variants, it sounds like mask, you're not necessarily protected.
Oh, no, absolutely not correct. The masks are as critical, if not more critical now than they ever were before. The masks work against variants as well as they do against the non-variants. What's happening is, I think, younger folks are getting together, they haven't been vaccinated yet, They may not be wearing a mask because they're hanging out with each other. That's where more of the transmission is occurring. Masking is just as important. It's more important than it ever has been because of the presence of the variants. Now is not the time to chuck your mask.
Thank you, Doctor.
Yep. Let me turn it over to Brian Sullivan next.
Thank you, Dr. Shah. I know in previous briefings, we talked about the previous administration maybe under delivering on the registration site that Maine ended up having to build their own based on maybe saying, don't wait for us. How do you view the time and money that was spent on Maine's pre-registration and now registration site?
Oh, I hear where you're going, Brian, and I don't have any concerns about that. Let me give you, so first of all, you are correct. The previous administration in Washington promised that they would have a nationwide scheduling platform. They did not. And as a result of that, all 50 states have had to figure out their own pathway. The majority of states, as far as I'm aware, 48 out of the 50 states are where Maine is, which is to say scheduling platforms were developed independently and the state is amalgamating those. Two states, or one state that I'm aware of, did go the centralized route, Indiana. It's not clear that their platform has put them into better stead than other states. Maine's investment, first of all, in our scheduling platform, it's not over. We are starting to use it for actual scheduling in the coming days at places like the Augusta Civic Center, as well as, for example, with the mobile unit as it's deployed. The other thing, though, Brian, is that the pre-registration was also very useful. Around about a week ago, I got an email from the leadership of a group that's running a large-scale vaccination site here in Maine. And this is a week and a half. And they had a lot of unfilled appointments. And they wanted a way to fill those really quickly. So what did we do? We went to our pre-registration list. And we were able to give them a couple of thousand names and phone numbers of people who had pre-registered in their immediate geographic area. And they were able to call those folks and get them in the door. So that pre-registration has been a valuable tool for us. So we're now going to convert again from pre-registration to using it for registration. But even there, that pre-registration has allowed us, when places have called us and said, we need to fill up our slots. First thing I do, of course, is put it on social media, put the word out. But in parallel, we give that facility a list of names and phone numbers that they can start calling and getting folks in the door. And that's exactly what happened.
Thank you. And just a question, this is probably asked and answered many briefings ago, but you've got a lot of people that are probably, I don't know what the correct term is, but half vaccinated recently, and now maybe feeling like they can take on the world, but probably shouldn't. So can you just go through how people should act one shot in?
One shot in is the same as no shots right now. I hear where you're coming from, and I've seen that as well. Folks have, but when we talk about the things that you can do when you're fully vaccinated, like get together at a private residence with other adults who have also been fully vaccinated and not wear a mask, hug your grandkids, go travel, that all is what happens 14 days after your second dose of Pfizer or Moderna, or your 14 days after your single dose of J&J. Anything before that, 10 days after your first dose of Moderna, 3 days after your second dose of Pfizer, doesn't count. You should still be going about your day as if you hadn't been vaccinated at all. The vaccine is working, it's doing its thing, but you're not up at that 95% protection level until 14 days after your second dose of Pfizer or Moderna, or after your single dose of J&J. Up until then, you should still go about things as if you haven't been vaccinated yet at all. You're getting protection, you're just not there.
Thank you.
Over to Ashley Blackford next.
Hi, Dr. Shah. I have two questions for you. The first, I'm wondering, how are these smaller independent pharmacies that are administering the vaccine getting their supply?
Ashley, I want to make sure you mean like just physically, how is it being delivered to them?
Yes. How, and then as far as like numbers go, how is it determined how much they get?
Got it. So let me answer that latter piece first. We work with and meet with the Maine Pharmacy Association pretty occasionally, and then we also meet with the individual independent pharmacies to learn about what clinics they can do, what clinics they already have scheduled, and then, as we were talking about with Caitlin, what's their total capacity. Some independent pharmacies on their own have decided to go out and find ways to do community clinics, which is great. Others have come to us and said, we want to be in the game vaccinating. Where can you deploy us? Can you send us to a nursing home to top up people? Can you send us to a group home with people who are living with disabilities? They come to us, or they already have the plans in place. So once we've made that contact with them, we again assess how many people that they can vaccinate in the coming week, what the supply is for that, and what the demand is. And then we connect all of those dots, we put them into our ordering system, and then the vaccine gets shipped directly to them by one of the couriers.
Okay. And do you have any update on the Aroostook County Jail outbreak?
As of this morning, there were 9 cases associated with the Aroostook County Jail.
All right, thank you.
You bet. Let me turn it over to Charlie from Maine Public next.
Hey, Dr. Shah, thank you. My only question, I had some others that have basically been answered. The New York Times has a tracker on their website for it looks at metro areas and their population adjusted difference in total new cases, kind of from the previous week compared to the week before that. And for that ranking today, Lewiston Auburn is 3rd highest in the country with 192 per 100,000 people. Pretty much all the others in the top 10 are in the state of Michigan. So that kind of stands out. And I wonder if, well, whether you had seen that or not, and if you have any thoughts on why that is. It did occur to me there is the outbreak at Bates College, for example. I don't know if that could be a factor, but anyways, yeah. What are you?
Yep. Charlie, I'm glad you raised that. I haven't seen that particular new tracker, to be candid, although I'm familiar that they've been doing that on a municipality by municipality basis. I hadn't seen the updated one. There are a few things going on in Androscoggin County, or Lewiston Auburn in particular. I think much of it is right now being driven by the number of cases at Bates. As of 2 days ago, they had logged 75 cases associated with Bates. In recent days, they have conducted several more rounds of testing. As has been reported to me, they did another round of testing on the 6th of April, where they ran an additional round of PCR testing, where they got 4 additional positives. And then yesterday, on the 7th, they did a full campus-wide screen with both PCR and antigen testing. They didn't find any positive antigen results, and they found 2 additional PCR cases. So I think, Charlie, what sort of is happening, and this is a hypothesis, is that it's an overall small metro area with a relatively large outbreak accounted for by Bates. I think that is what's driving much of this. There is another outbreak that I've just received word of a little bit earlier today associated with the long-term care facility. I don't have all the details on it. As I understand it, that's only 4 cases right now, though, so it wouldn't drive that. So my hypothesis, Charlie, is that this is largely a function of what's undergoing at Bates. I've spoken personally with the leadership as well as with President Spencer at Bates. They are taking this very seriously. They're doing multiple rounds of testing every single week, campus-wide, as well as making sure students are safe and sound within their rooms. So I know they're on top of this, but I think that's what's going on.
Okay, thanks. That's it.
Thank you. Yep. And the final question for the afternoon goes to Megan at WMTW.
Thanks, Dr. Shah. So I think by the answer to Chris Costa's question, I may have gotten my answer, but can you just confirm that the mobile units vaccine supply is allocated by the state and not the federal government? That's correct?
That is correct, Megan. That is correct.
Okay. So moving forward, if the decrease in the J&J shot continues, does this at all change the schedule or the strategy? I mean, does it require a second look at the mobile unit and where or how long it stays in one place? Is that something that you've thought about?
At this time, we're not really changing the locations of the mobile unit. Much of that, again, the supply of vaccine that we are utilizing for that is a function of where we see what we are getting from the federal government. We're hoping it doesn't fall below the 2,200 to 2,400 per week that unit can undertake. So at this time, we're not anticipating having to change the schedule because of decreases in J&J supply. We believe we'll be able to, but we are examining that very closely. If the J&J supply does go down, then our plan is to make sure we communicate that to the federal government. Given that FEMA supported this site, supported the unit itself, we want to make sure that they are aware that we need the vaccine to make that happen and get that vaccine to the unit.
Yeah. Also, we've reported that the UK variant is now the dominant strain in the United States. Is that true for Maine?
It is not true for Maine. Although it is true nationwide, overall, based on the sampling that we've done in Maine, although the UK variant is here, it is not yet the dominant strain, although that remains a risk.
Finally, one last question. Anecdotally, we've kind of heard that people have seen less masking, people maybe a little bit more willing to gather in groups or go outside without masks on. And earlier you had mentioned, the rise in cases among young people. Are these two things commensurate, or is it the younger folks that you're really concerned that you want to get the message out that this is still something that that needs to happen?
I think there's a cause and effect relationship there. Now, one of the reasons that the average age of new COVID cases has come down is because older folks in Maine have thankfully been vaccinated. But we are also seeing more transmission occurring within younger folks. All the more reason right now why wearing a mask, maintaining distancing is just as important as it was before. I know there's this sense that sunny outside, folks are getting vaccinated, COVID is behind us, but we're not out of the woods yet.
Thank you.
Thank you. I'm going to try to move things around just a bit. I think we can squeeze in the last two questions, but my apologies. I might have to be just a bit quick on that. So the next question goes to Evan.
Hi, Dr. Shah. Thank you. Just a quick question. I heard that Gateway Community Services is offering a vaccine clinic, specifically looking to connect with new Mainers next week. Just hoping to get your reaction on that and wondering if the state is working with some other groups, some other immigrant groups on that issue as well.
Absolutely, Evan. We've talked about, and you've heard the Commissioner Lambert and I discuss equity-based pop-up clinics. We've encouraged sponsors of those clinics, be they groups of new Mainers, other groups who are hard to reach or vulnerable, to reach out to us, do a simple application, and then we'll take that and pair them with groups that can do the vaccination. You heard me mention in connection with Ashley's question a moment ago, we could, for example, pair them with an independent pharmacy that could go on site and provide vaccine for these groups that we know may be reticent to go to a large scale site or may be harder to reach. So we're very supportive of that. This is a deliberate effort that we've been rolling out, not just for new Mainers, but for a number of different groups to make sure they've got equal access to vaccine.
Great. And I also just wanted to check in. We've talked in the past about that chunk of data on the racial and ethnicity breakdown that has been not provided to the CDC. That seems to have come down since we last talked. I think it's around 9 or 10% now, but I'm still a chunk of data there. I'm wondering if you feel like the CDC has a handle on whether there's racial disparities present in the vaccination process or whether that unknown data still makes it tricky to tell.
It still makes it tricky to tell. I think we need to know exactly what's in that data set. We've been working with providers to urge those who are coming to get vaccinated to fill out all of the information. So we've got a full and complete picture, but not knowing what we don't know in that chunk, it's hard to make predictions or pronouncements.
Great, thank you.
Yep, and the last question goes to Mel Meyer.
Yes, my question is about the J&J decrease. Should those Mainers who have signed up for clinics where they know that they're getting the J&J vaccine, should they be concerned that their appointments may now be canceled, and should they be looking for an appointment somewhere else?
So generally speaking, we have urged vaccination sites not to go forth with scheduling appointments until they know that their doses are confirmed. In fact, I personally often will send emails Wednesday, Thursday morning to sites to let them know that they are locked in for their allocation so that they can begin scheduling. As soon as we lock in allocations, I like to send those emails out because every hour matters when it comes to scheduling. So that's generally been the advice that we've been giving to folks. Don't schedule before you know you're going to get your vaccines. That way you don't have to cancel. With the decrease in J&J, it is unfortunately the case that some of those appointments may have to be canceled. I would wait to hear, but yes, if those are canceled, the best thing for folks to do will be to go and find another appointment. That may be a challenge. And that's why, again, we don't generally recommend that vaccination sites open up scheduling until they know for sure that their allocation for the next week is a lock.
And then my second question, I spoke with Mainers who used the pre-registration website and received an email about the next steps. They were surprised to be directed back to the state's list of vaccination sites. What do you say to the thousands who have used the service and are now having to book an appointment using a list that was already publicly available?
Well, I say that many of those folks have already gotten an appointment. As I mentioned a moment ago, we've provided pre-registration lists to vaccination sites who needed to fill extra spots. So many of those folks who are on the pre-registration list have been registered and have been vaccinated. Others may still receive a code to go and register when a spot opens up in their area. But now that vaccine is available to now that everyone is eligible for a vaccine, we didn't want those folks to wait until they got a code from us. We wanted them to move forward and find a spot on their own. We hope they're able to do so based on what I've been seeing and based on the fact that yesterday was the single biggest day for vaccinations in Maine. A lot of folks were able to get a spot, which is exactly what we're looking for. So thank you all for your time this afternoon. I apologize that we went a bit over, but I wanted to make sure that we had time for all the questions today. I wanted to just end on this note. We know that there is still more demand for vaccine than there is supply. Hopefully that supply will start easing, and not just in terms of the absolute number of shots, but also the location, with more places coming online to offer vaccinations in the coming days with the mobile unit and in the coming weeks as we try to bring more opportunities available. Getting the vaccine is our quickest and surest way out of this dark tunnel. I want to urge everyone to do so and keep sending in your questions. From time to time, we'll take a minute to answer your questions to make sure you've got truthful, scientifically based answers to your questions. With that, I hope everyone has a good day. We look forward to chatting again next week. In the meantime, as always, please be kind and take care of one another. We'll talk soon.